Well, I think there's good scientific evidence that right now, people in the teen and young adult age group with the same diseases as older people or younger people are not getting as good results.
We know on the pediatric side that if you're less than 15 years of age, you have an overall 80% chance of cure. And then if you're an older adult with kind of these big common diagnoses like breast or colon or prostate cancer, also very high cure rates. But then within the teen and young adult population, it's something called the AYA gap, or the adolescent young adult oncology gap, where they don't see the same rates of cure.
The diseases are also very different. As an example, for example, in the world of acute lymphoblastic leukemia, when we look at very, very young kids, they do really very well with some of these chemo regimens and really have very good survivals. In the adult population, the whole group tends to do in the same way in terms of tolerating treatment and transplants and so on. But when we look at the young adult population there, it is a very big difference in terms of where they get their care and how they get their care and the treatments that they receive.
You could be 15 and you could get treated by a pediatric oncology center, or you could be 15 and get treated by the adult side of medicine, and two very different systems of care. There are certain resources that are available if you're on a pediatric service, like you have child life specialists who can talk you through kind of developmental issues that you might be facing. There might be certain school resources that you have on the pediatric side.
On the adult ward, they hardly have access to resources to at least cater to them. You know, we have things that cater to 40 and 50 and 60-year-olds far better than what we have in terms of, for a teenager.
And so if you're a teenager diagnosed with cancer, at UCLA in the old days, or in many other places, you would be put with the 6-month-old with leukemia. And there's clowns coming into your room and there's, the fish tank. But that's not where you are when you're 17 years old and somebody's telling you we're going to remove your testicle and you're going to lose your hair. And yet you're also not comfortable with an 80-year-old who's dealing with lung cancer in the room next to you. So when you really think about how devastating the journey of this illness is, and you couple it with your developmental stage, it was really important for us to make sure we got that part right.